So to say that this is the first sort of showing that we are on the post-lockdown opinions and lifestyle survey performed by the Office of National Statistics. At this point, England was in restrictions. Wales was having a fire break, which ended on the 9th of November, and Scotland had parts of the country in higher level restrictions due to its 5 levels. What we can see here is that 81% of adults avoided contact with older or other vulnerable people in the previous 7 days. We also can see a very high take-up of face coverings when outside the home. 98% of adults wore face coverings. And again, there's a high take-up of working from home. 38% of people worked from home because of the pandemic in the previous week. And that compares to normal working from home of about 12% in the previous year. And finally, on this slide, you can see that people are really washing their hands, especially when they return from public places. And it's excellent to see that 89% of people wash their hands with soap and water when they return to their house. I'm now going to hand over to Angela for some further slides.
Susan, thank you. If I could have the next slide, please. What we have here is a record of how much people have been moving around using Google mobility data for the time period starting from the 1st of October, running straight up to the 13th of November. And this is how much people are moving relative to what would have been normal in January before the pandemic arrived. So what's particularly good to note is that straight around the 5th of November, you can see in an orange and a blue line a big fall in the number of trips that people are making for retail and recreation or through transit stations, that's places like railway stations and bus stations. Not surprisingly, given the way things are this year, people are spending more time at home, that's the top purple line called residential, and more time in parks, although we all know the weather's not been so fantastic since the latest set of local restrictions came in. Next slide, please. So these are our estimates of how much the famous R number has changed week by week since the summer. So what this number counts is what would happen if one infectious person were infectious and counts how many people we would expect that person to infect. And this week, the estimate of the R value for the UK is between 1 and 1.2. And the best way to think about that is that if we had 10 infectious people, on average, that between them, they would infect 12 other new people. And what you can see from that graph is that the R number was really quite high for a while in late September, early October, somewhere between 1.2 and 1.5, and has been falling, but has not yet fallen below 1. And it's very important from the point of view of the progress of the pandemic in our country that it should fall below 1, because only when R is less than 1 will the number of infections in the country be falling. As a final point to emphasize with this graph, which is that the methods that we use for estimating R have to, by definition really, use data that is time-lagged. So these estimates are done in using data on how many people are in hospital, how many people have died sadly, and also using some data about how much people are moving around. So these are always a backward look. So the fact that R is still above 1 for our 13th of November estimate is not a particular worry, even though we had already been in national restrictions in England for over a week by then. Next slide, please. So these are the data that are collected by something called the COVID Infections Survey by our Office for National Statistics. So what that survey does is it visits people in their home. It visits very large numbers of households and takes swabs in the nose and throat of everybody over the age of 2 who agrees, who lives in that household. And it goes week after week to the same set of people. So the great thing about this data is that it's not affected by who feels like going to get themselves tested one week or another. What you see in here is the patterns that we've observed in this survey since the summer. So the first data is the 13th of August, and the most recent data here is the 6th of November. The blue line counts how many people in the survey that week had a positive swab test. And what you see there is about 650 positive swabs. And over the past 2 weeks in this survey, more than 150 people took part. So at the moment, our estimate is that about 1 in 85 people living in our communities would swab positive if you were to take a swab from the back of their throat and nose. It is important to know that this survey doesn't cover people who live in institutional settings. So it doesn't cover care homes, it doesn't cover students living in halls of residence or events in hospitals, for example. Notice that the curve went up quite steeply through September and October and has slowed down. It's not going up as fast anymore, but it hasn't gone flat yet. But that's okay, because the last date any swabs were taken that are shown on this slide was the 6th of November. That's just the day after England went into national restrictions. So we wouldn't expect to see the impact of the national restrictions in this data so far. The next slide, please, is the same data, but split out into 9 different regions in England. And what you see is that even before national restrictions were brought in the parts of the country where the amount of infection was already very high, the progress of the epidemic had already flattened off. So that's the northwest and the Yorkshire and the Humber in the top left there. Those also happen to include the parts of the country that were under Tier 3 restrictions. So that's good news. That some parts of the country have already flattened off in this survey. Not so good news is that if we look down at the bottom right, in the southwest and the southeast, progress of the epidemic has continued to rise. And those are parts of the country we'll be watching the whole country incredibly carefully next week, and particularly so those parts of the country that were showing a rise right up to the 6th of November. I think that's the last slide for me, thank you. I'll hand back.
And now I'd like to ask Professor Steve Powers, the National Medical Director, to present related to the NHS data.
Thank you. If I could have the next slide, please. So as Angela has shown you, infection rates are continuing to rise. And as I have said at previous briefings, unfortunately, a small proportion of people are sick enough with COVID-19 to require a hospital admission. And that typically occurs up to 2 weeks after an infection occurs. So there is always a lag in the hospital admission data compared to the infection rates in the community. So this first slide shows you the number of admissions into hospital in regions of England and the devolved administrations. And you can see that by and large that we are seeing increases in the number of people being admitted into hospital. There are some areas where you can see that there is beginning to be an effect of the measures that are in place. So in England, I would point out the Northwest, which is on the left side of the chart in yellow. And in areas of the Northwest, there were Tier 3 measures in place before the latest national English lockdown measures were put in place at the beginning of this month. And we are beginning to see some plateauing of numbers of patients in hospital and perhaps some decrease in the Northwest. But you can see in other areas such as the Midlands, numbers are still very much rising. On the next slide, you can see the picture across all of England in terms of the number of patients who are in hospital, in our hospital beds. I last did a Downing Street briefing last Thursday. At that point, 12,967 patients were in hospital. It's now 14,411, so that's an increase of 1,444 in the space of just about a week. So we are unfortunately still seeing increased numbers of patients in our hospital beds. The effects of the lockdown measures that were introduced a couple of weeks ago will not feed through into this data, I don't think, until this weekend or next week. We clearly need to see these numbers reduce, particularly in those areas of the country with the highest numbers of patients. There is pressure on our health system. Unfortunately, that means that in some cases that has effects on other services. So it's really important as we go into this winter that these numbers come down and we get into the real heart of winter with much, much lower numbers of COVID patients in hospitals. At that point, I'd like to pass back to Susan, I think, for the rest of the slides.
Thank you, Steve. So this slide shows us the deaths within 28 days of a positive COVID-19 test in the UK. And sadly, the deaths reported yesterday were 598. These are the highest deaths we've seen since May. But we should note that the deaths on Tuesday have always had our highest numbers, but it is still higher than last Tuesday when we had 532 deaths. These are cumulative deaths that we've seen across the UK using 28 days is 52,745 cases. And the ONS have reported a cumulative registered deaths of COVID-19 up to the 6th of November of 63,873 cases. Next slide, please. Of course, many people wonder about are these people that sadly may have died because of another condition. But what we are seeing here is, first of all, in the dark blue, the deaths involving COVID. In the light grey, the deaths not involving COVID. And in the orange line, the all deaths for the 5-year average. What we can see here, and which we all are very much aware of, is throughout March and April, we very much saw an excess mortality compared to the rolling 5-year average, not just on COVID-19 deaths reported to the Office of National Statistics, but also in deaths not involving COVID. Over the summer months, that equilibrated and became much more similar to our normal 5-year average that we see. But sadly, over most recent weeks, we have seen an excess mortality again, as indicated by the dark blue line and dark blue boxes on the most recent weeks. This is clearly concerning, and this is clearly one of the reasons why the national restrictions had to come into play. Thank you very much. That finishes the briefing on slides. So we'll now go to questions. I just want to invite Hugh Pym from the BBC.
Thank you very much indeed. Can you confirm whether, subject to a final decision to be made, you are looking at the possibility of some limited form of household mixing over Christmas and how that might work?
So I think the first thing to say is that we are very keen that we have Christmas as close to normal as possible. That requires all of us to make every effort over this national restriction period and even in early December to get the cases as low as possible and to reduce the risk of transmission within households and between families. A final decision, of course, will rest with the government and we look forward to hearing what those plans are. Angela, do you want to add anything?
Like everyone, I'm also looking forward to hearing what the plans are.
But are you modelling the possibility of some form of household mixing being permitted with other restrictions being in place?
I think the best answer I could give to that is we did send some advice in over the weekend, but we genuinely don't know what decisions have been made.
But do you think it's feasible that that could be allowed with other restrictions and other trade-offs?
Well, I would reiterate what Susan just said. What's really important is that we go into, a festive week when we want to mix with our friends and our family, with the number of infections in the community as low as possible.
So is some sort of Christmas possible, do you think?
So I think it is. And I think the other thing I would say is that some of the sage advice previously suggested that for every day that we release, we'll need 2 days of tighter restrictions. So coming into Christmas, we need to be very careful about the number of contacts that we have to reduce transmission before Christmas and get our cases as low as possible. Hopefully, the government will make the decision that will allow us to have some mixing, but we will wait and see what that is. And then I think once we have got past the Christmas period, if there's been a release and some socialisation, we will all have to be very responsible and reduce those contacts again.
Thank you.
Thank you very much. I'd like to go to Roland Manthorpe. Sky, please.
Hi there, thanks as always for this. If the R doesn't come below 1 this week, is it too late for lockdown to work by 2nd of December? And another question about the Google mobility stats. You've said that people are travelling less since lockdown, but there was a distinct and pronounced jump in retail and recreation just before lockdown. Does that partly result in the high level of cases that we see now? And does that cause you a concern for Christmas, this feeling that once restrictions are lifted, or if they're going to be put in place, then people will really go out and party?
Angela, can I have that over to you?
Surely. So question in two parts. Your first question was, if R is not below 1 this week, is that terrible news? And the answer is no, that is not terrible news. We very much hope that R will be lower again. But as I've tried to explain, the way we estimate R is very dominated by what we would call lagging indicators. So people who are in hospital or people who have died. People who are going into hospital now are people who got infected weeks ago. So that data stream reflects what was happening before the latest national restrictions arose. So no, I think is the short answer. If the R that comes out on Friday is not below 1 or not firmly below 1, that does not mean that that the national restrictions haven't worked. The two are completely compatible. National restrictions work. R is still a bit above 1 this week. That would not cause me any concern at all. In terms of a bump in activity in the days, it's really looking at the data here. It looks to me like in the day before 5th of November, when national restrictions came along. These things are all a worry to us, yes. You can imagine why people would want to maybe get some shopping in before the shops were all shut. And yes, I mean, this plays to exactly what Susan and I have both said, that we are concerned about how can we have a safe run-up to Christmas so that we can have some kind of a good family Christmas.
Thank you very much. Emily Morgan, ITV, please.
Hello, it's another question about Christmas, I'm afraid. You say that no decisions have been made about Christmas, and we all know that we're not going to get a normal Christmas this year. I just wonder what your best case scenario is for planning Christmas. What is the sort of at best, how many households can we hope to mix with?
So I don't think we can answer that. This is a government decision, and it will be a decision that will be made by government. And I know that they're working hard to develop an outline of what that will look like and what the new tiers will look like post-December the 2nd and what Christmas will look like. So we'll have to leave that to them, I'm afraid.
Do you think, though, that the government will even countenance if cases are still rising, a Christmas where we can't mix with households?
I'm afraid we'll have to wait and ask them.
I can honestly tell you, I have no idea what they're countenancing. I really don't know. And you have to remember, we're advisors. They decide, we advise.
Thank you very much, Emily. Ella Pickover.
Good morning. Just touching on to December again, and could you, do you think that socialising should be banned indoors when lockdown ends in December, given the evidence from yourself, Dr. Hopkins, and SPI-M suggests that Tier 1 has no effect? And separately, if we could touch on vaccines, please. Is it Public Health England and the government's intention that every adult who wants to get a coronavirus vaccine should get one? And to Professor Powers, please, the NHS has been instructed to be prepared to deliver a vaccination programme by the start of December. Please, could you update us on how these preparations are going? And are you prepared to take on multiple different vaccines, given that they have many different requirements, such as temperature and storage?
Angela, do you want to make a comment on any of SPI-M modelling?
It's pretty straightforward to look at the different parts of the country where different tiers were imposed, and you can see whether epidemics were growing, shrinking, growing faster than it used to. That's not a difficult analysis to do. I am actually pretty confident that those sorts of considerations will be taken into account. I've a bit of a cracked record. I don't know what decision will be made.
Thank you very much. Steve, over to the vaccines question, please.
Thank you. And I should say, obviously, I'm on Zoom today. I can't join you in Downing Street, and that's because a member of my household recently tested positive for COVID, and on the instructions of test and trace, I'm self-isolating. I should say I'm completely asymptomatic and perfectly fine, but I will be staying at home until I have completed my period of isolation. On the vaccination question, as I said last week, the NHS has been working incredibly hard to ensure that we are ready to deploy vaccines and to make sure vaccines can be delivered as soon as the vaccine trials have finished and the regulators have looked at the data and given approval for the use of vaccines. We will be using our traditional vaccine routes, so general practices, likely community pharmacy, but we will also be looking at other vaccine ways of delivering vaccination, such as vaccine centres. The vaccines that are at the forefront of the production of vaccines, so the Pfizer vaccine you will have heard of in the press recently, have different characteristics, and the way they can be transported and the way they can be delivered is different. So we are planning for different types of vaccine, and the plans around the delivery mechanisms will be contingent upon the particular vaccine and, of course, the data that comes from the trials and the advice of regulators. We will be saying more about this in the next few days, but meanwhile, we're working hard. We're ensuring that we have the workforce to do this. Talked about general practice who are stepping up for this, but St John's, for instance, are also recruiting volunteers, so we have additional vaccine workforce. We will be laying out more of this in the days and weeks to come.
And just on the final comment, just to say that the Joint Committee for Vaccinations and Immunisations advises government on who are the priorities for vaccination. They have laid those out as interim priorities, but the full priorities will be laid out once the vaccine's known. Thank you very much. Kat Slay, the Times, please.
Hi there. Looking at the potential new tiers that we might have after lockdown and going into Christmas, does any of the modelling that you've provided to government envisage a new tier 4 that's more similar to the lockdown measures that we have at the moment? And are the mass testing pilots likely to play any role? Will we have any data from them in time to potentially make a difference in terms of what can be eased around Christmas or early in the new year?
Angela, can I hand over the modelling question to you, and I'll take the mass
So
testing.
we much prefer to talk about modelling work in consensus statements where we put together work that's been done by several different groups, and we haven't gone through that process yet for the question you just asked. Actually, I'm missing our weekly modelling meeting because I'm here, so I don't know what they're doing right this very minute. So actually, the honest truth is I don't know what has been looked at from that, in terms of more, what's a good word, tougher interventions than tier 3. I think when I look at the Northwest and the Northeast, when I look at what's happened with the ONS surveys there, I see interventions that have worked. I see epidemics that are flattening, I feel there is some good news there.
Great.
And there's, okay, fine.
So I think from the point of view of mass testing, so what we've got is a large-scale pilot happening in Liverpool at the moment, working very closely with local authorities, directors of public health, academics and the NHS around Liverpool. And we're using this as a mass asymptomatic serial testing workstream, where we're finding people who do not have symptoms, but yet are at risk of transmitting to other people. And clearly, the ambition is that this will help reduce the prevalence of infection in Liverpool, and therefore that they will come out of this with less infected people who could transmit to others. We are in week 2. They've made great progress. More than 100,000 people have had tests since it started. That's really good news. And this will really allow us to understand how to get people to come forward for testing, who should come forward for testing, and what that intervention does to the overall prevalence in a city. So thank you. Finally, Ian Semple in The Guardian.
Hi, thanks very much for this. These lockdowns work best when the time is used to beef up virus control measures, so the cases don't just bounce back afterwards. What meaningful changes have been made in this lockdown to keep infections in check after the 2nd of December? And on a related note, the ONS data suggests about 650,000 cases in England. What prevalence would you regard as a good result for this lockdown come the 2nd of December?
Angela, do you want to start with that one?
So I'll start with the second one, if I may. What would be obviously what would be a good result would be, well, let's have a think about during the March lockdown, the number of hospitalizations, which was really all we could keep track of at that time because we didn't have ONS then, was halving every 3 weeks. I don't think we're going to achieve that. So I would say I would be surprised if, well, let's have a think. I don't think we'll halve over, but I do not think we will halve before the 2nd of December. There we are. How about I put it that way? Because then if I'm wrong, we could all be happy.
Thank you. In terms of what we are doing, so clearly NHS Test and Trace has increased its testing capacity. And that's been a very important intervention. And that basically has allowed us to try and work on decreasing turnaround time for those people who get tests in person. We're also working very hard with local authorities to enhance the contact tracing system. And by the end of this month, almost every lower tier local authority will have local contact tracing in place. So that's really allowed us to step up. And that's an amazing achievement. You know, in the summer where we were having 1,000 cases a day, we were contacting on average 2,000 to 3,000 people per day. Right now, with almost 30,000 cases a day across the UK, we're managing to contact over 100,000 people per day. That is a huge achievement in itself. And really what we're building is a local and international system that will sustain us for the months to come and also in the future, any future epidemic and pandemic. Thank you very much.